In today's video, we're going to talk about the fact that you applied in the match and unfortunately did not match. We'll talk about the things that could have gone wrong and how we can fix them. Number one, bad or poor USMLE scores. So if you had bad USMLE scores now, that is a red flag and may play a big role in the fact that you did not match. But can we overcompensate or compensate that problem? One way to compensate would be USMLE Step 3. If you have not taken USMLE Step 3, I recommend that you do. Now make sure you score very well on that exam, because if you did not score well on Step 1 and Step 2 and you scored well on Step 3, that would be a strong implication that you are a good scorer and that the Step 1, 2 low scores do not define your ability to pass these exams. Unfortunately, if you fail Step 3, then that's another red flag. So make sure you study well and ace Step 3. Number 2, an old graduate with a longer year of graduation. Now that per se is not a huge red flag, in the sense that it's very important for the program director to know what were you doing since you graduated. So we'll come to this, but the time you have spent after the graduation is of utmost importance to their ability to recognize you as a candidate with good CV. And number 3, letter recommendations and personal statements. Now I know for a fact that many program directors do not read your personal statement because majority of them, according to them, are copy paste from the internet and they may not represent who you are. Plus, many are poorly written with bad grammatical errors. Now, if that's a personal statement that reflects one of yours applications, I would strongly recommend to change it and make it look more real. It should be not copy pasted, should have no grammatical errors, and should be a reflection of who you are, because nobody would read it to rank you or to give you an interview. But if they find errors in it, then definitely they're not going to give you an interview. Now the letter recommendations, I don't know if you have access to them, but it is very important that these letter recommendations for the next year match are very personal letters, in the sense that the letter writer tells the program directors how they know you, and it should mention exact details. It should not be an overall that Dr. A is a very good medical student and would excel as a surgeon. It is a good letter recommendation is more like this: Dr. A worked with me on the transplant rotation. We went on donors. He or she presented a case of acute cholecystitis. It was in detail. She has scrubbed with me, or he's good in the operating room. So these are what makes a letter recommendation a better one, that they have given substantial details of their encounters with you. So try to get letters from people you have worked closely with, and in this time you can work with more people and to make sure you have better letter recommendations. Number 5. Now this is linked to your year of graduation, but it's what is in your CV. Now that is very important when it comes to competitive fields, especially, for example, the ones that want you to be an all-rounder, for example, such as surgery. So research, have you been doing research? Now, if you have not, that is a very important thing that you can easily compensate for. I recommend going on websites on the university programs, searching up the lead researchers on PubMed, and many of them have a track record that they have helped, for example, IMGs or medical students who have already graduated getting into surgical residency. If they have a track record and they are publishing and they have had research fellows match into general surgery, if I was you, I would reach out to them and be honest with them. And I think they already know that you may not have matched and your goals are to get into general surgery residency next year. Now remember, next year match is only 6 months away, so you do not technically have a year. So you have to be a little fast on your toes to get this going. I understand this is more stressful time, but you can do it. So that would be one thing, to reach out to people who have a proven track record and see if you can do research. Publishing one or two papers and then getting them to vouch for you is a big plus, and that is a major way how many candidates who did not match can match. Other thing would be to prolong your year of graduation. Maybe you can enroll yourself into an MPH program and ask your school, if allowed, to extend your year of graduation and apply as a US senior rather than a graduate. Now, these are the things that may be the red flags in your CV, and I've mentioned to you about the things or ways you can fix them. The other possibility could be a change in your specialty, but make sure if you're going to a less competitive field, you have the letter recommendations, the experience. If you're someone who did not have much clinical experience, or that is something that can be achieved during this time, that you can rotate with clinicians in that particular field to get better letter recommendations. Lastly, but not the least, unfortunately, you are not the only person who didn't match, and even more sadly, you will not be the last person to match. The match process is a way where people match and some don't match. There's always a way around it. I have seen many candidates who have been successful, and many people who have had failures in many matches only to become successful in the third or the fourth match. And the key comes down to this: how hardworking you are, how committed you are, what you want to achieve in life. So I have given you a roadmap of things you need to do. Remember, the next match is only 6 months away. It's not 1 year away. It's only 6 months away, because your application would go in September. So all the publications, all the research work, one research work takes 6 months to get on PubMed. But does that mean you should not do research? You should definitely do research, because you can always mention the publications that are in process or even you've submitted. Plus, that phone call or that recommendation of that attending to your program director is a big plus. So you should definitely do it. Again, goes with the letter recommendations, goes with the clinical rotations. So in brief, act fast, don't lose hope. You will match, and happy to help in any way regarding any questions or comments. Thank you.